G'day guys, Darcy here from MMT. I'm with my good mate Dorf, who's got some right shoulder issues. Today I'm focusing on a muscle that is forgotten when we're talking about shoulder pain, and that is your brachialis. But Dorf, I want you to tell me exactly what's going on with your shoulder, where's your pain, and let me know.
I'm just feeling a bit of pain with some shoulder movements just through the front here.
Yep.
But then also feeling a little bit of tension down here as well.
Yeah, which is why Dorf was our perfect candidate for today, because he's actually getting pain in this area. And I've had a lot of clients lately with shoulder pain. I've been treating this little guy and getting so much relief and success out of it. So I thought, Dorf, let's fix your shoulder. You've got some stuff going on. Why not give it a crack? So shirt off for me, man. Let's get you lying flat on your back. All right, thanks, mate. So the right shoulder.
The right shoulder.
All right, I'm going to show you exactly how to treat it and how to treat it correctly. So I've got my Myo wax to begin with. All right, so what I'm going to do is I'm actually going to start right down the bottom in the elbow crease and connect in there with my pisiform. That's sort of my connection point to begin with, connecting with tendon to begin with. All right, so we know that our brachialis starts like midway in our humerus, so it attaches in a funny spot. It's not like a bony joint landmark. It originates right in the middle of the shoulder bone, your humerus, and connects into this elbow crease. So I'm just going to start in here, and Dorf, what do you reckon so far?
Yeah, no, it's good you connected there.
Yeah. Don't need a lot of pressure. It's pretty intense once you start to sort of push firmly through this area of the arm. You can get a lot of stuff down the forearm.
Oh, bit of referral there, it's good.
Yeah. Yeah, I'm going to get up into where Dorf's complaining of as well, but I want to start down here because, I want to see what it's like treating this brachialis and seeing how much success we get out of it to begin with. So I'm just like, what I'm doing is, this is my palpation stroke. I'm sort of palpating and maneuvering. There's actually lots going on under my stroke. Might not look like much, but under my palm.
Yeah.
Yeah,
I feel that.
Yeah, and I reckon that's the culprit.
Yeah.
That's the issue. This guy, it is forgotten about. We don't treat our brachialis. Sometimes we go biceps and pecs and deltoids when we're considering shoulder pain or dysfunction. But this guy is the forgotten nugget. Oh yeah. Okay, so I'm gonna keep creeping through there. It is like a speed hump when you do come to it. And if you're playing along from home, you were to just like palpate there, have a feel on your own shoulder, and that's quite sensitive or sore, and you go, okay, maybe that's why I'm getting shoulder pain. Maybe that's the guy behind all my issues, and then find the right therapist for them to treat it. All right, so warm up done. Let's get straight into the spot. I've palpated, I've felt where the nastiness is, where the block is literally a speed hump, and I'm just gonna slow my talking down so Dorf can actually take in this treatment and then pin.
I'm taking it.
You're taking it. Oh. There we go.
Oh.
Yep.
Oh.
What are we feeling?
Just a bit of referral down at the forearm.
Okay.
Yeah.
So more down than up.
Oh.
It'll be interesting to see if we get anything up into his pain. Yeah, into his shoulder. What do you reckon this is from, man? Why have you got shoulder pain if I was to put it back on you?
Well, treating.
Yep.
Treating would probably be the biggest one.
Yep.
I've just noticed with the squatting, getting the shoulder back, getting the hand position, especially with a tight grip, just getting into that externally rotated position is a bit of a tension point through the shoulder. So.
Because we're like anteriorly, like if you look at me now, right. I'm in an anterior position where I'm using a lot of my shoulder and a lot of my pecs.
It's a lot of anterior.
Yeah, it's over dominant, and then we're restricted through external. As therapists, this is probably But it's also, this guy will flex the elbow. Your brachialis, what its movement is flexing the elbow. So bicep curls, carrying your shopping if you're not in the gym, carrying anything, lifting, gripping, holding.
But I don't do bicep curls now.
No, he doesn't do bicep. Just naturally gifted from the gods. Oh yeah. So I haven't moved a lot. I'm just trying to reduce this speed hump. We're going to refer to it as that because it literally is that in your arm, and I'm connected onto that bone into the tendon. I'm probably still a bit, yeah, his Dorf's feeling like he needs to move it, and let's try flip, yeah, bringing it up. Yeah, nice, man. I'm probably, nasties.
That's a good one.
Yeah. It is one of the most sensitive areas on the body to get treated. It's always tender, and there's got to be a reason for that. So unraveling it, letting go of it, it's going to have so many flow-on effects and benefits. Yeah.
Oh,
just sort of pinning it.
Yeah.
There we go, swapping hands and just rotating. I'm just getting a nice stroke that I can sort of pin, and then I'm like connected onto the bone, but I'm like scraping away the debris, scraping away the build-up.
That's it. That's it there.
Yeah, you can feel that. And when we get that feedback, that is intelligent information. That's it there means stay on that and hold it. That's my pain. Oh. Normally I'm not talking all the way through my therapy, but for the video's sake, and I just had a little crack off there. That was something, jeez. There we are. Nice. All right, I'm gonna speed it up. I'm gonna show you another tool. Before I get up a little higher, warm the elbow up. All right. Yeah, how's that starting to feel? You can see, come here, Dorf's got quite a large brachialis as you tense it. Look at that guy there.
Which one?
Right here. See that? That's our brachialis. It's not our bicep, it's not our tricep, it sits center of that, and that's what we're changing. That's the forgotten muscle when dealing with shoulder pain. And I'm gonna, yeah. All right, and let's go with a firmer tool.
Get it through here.
There it is.
There it is.
Okay.
There it is.
Interesting. Yeah, normally I haven't spent a lot of time just treating this part of the shoulder. I'm normally focusing on pecs and the more dominant deltoids and bicep tendons and all these muscles up in the shoulder. But I've spent 5 or so minutes on many of my clients' brachialis lately, and I've just been getting so much feedback, like, that's my pain, that I can feel that you guys on the other side of the camera who have got shoulder stuff going on, need to be educated, need to be flicked off it, coming back out, and bam, there's that scrape. I'm gonna pin and
dust.
Yeah. Let's try and sink your head into the pillow, take a couple of deep breaths. Right up there, isn't it? And is it coming up into here, or what's that?
It's coming and going.
Yeah.
I had a strong one at the start.
Yeah. You're doing well, man.
I'm scared.
Yeah, it's intense. It's not for the faint-hearted, but if you've got chronic shoulder stuff going on, impingement, just pain down the lateral aspect of the shoulder, you've got to be willing to give it a go. Let yourself go. Yep. This whole time I've moved an inch. This whole 10 minutes I've been treating or so. I'm going to move along. Nothing fast. We're being thorough with our treatment. And just breaking down that speed hump, breaking down the debris, the build up, creating more flow in an area that's stagnant. Yeah. Back to our philosophies. Creating flow. Attracting blood. Getting fresh oxygenated blood that are carrying good cells, good oxygen, white blood cells that are going to heal this shoulder.
Cleaning the house.
Cleaning the house. Unblock one area, unblock one drain, the whole pipe starts to work, you know? Clean this gutter, the whole system works. Yeah. So I'm feeling on the other end of this is just a nasty little golf ball of a knot under my elbow that I'm breaking and melting.
Fuck.
I guess I wouldn't call it breaking, it's more melting. How you doing? Is it still intense?
Pretty tough, yeah.
Yeah. Not for the faint-hearted. How many times have you been training? You had a session this morning?
Yeah, a bit on and off actually. Haven't been training too much. Yeah, pretty sporadic, but that's probably it. Like when you're out of condition and then you have, you know, mobility problems because you're not working it properly, and then you know the consistent aggravation in a certain way. You go back to a different movement, put a bit of pressure on it. Just not happy.
Totally.
So yeah.
Totally. It's important to keep up your release work. So if you don't have a therapist, get on a ball, get on a massage gun or a foam roller and break up these tissues in between your rest days.
Fuck.
Look after yourself. Okay, I'm almost on the other side of that. There's still a bit going on.
Yeah. It's good to do that low intensity exercise as well.
Just something to get the blood flowing in the body. Good for the mind.
Good for recovery.
Yeah, recovery.
Oh.
So if you guys didn't see that, that was like a power line that I'm sitting on. It's like a tightrope.
Power line. Yeah, we'll go with that.
We'll go with the power line. Yeah. Don't touch the ground. Yeah, I'm giving him some absolute curry.
Oh, there's some electricity in there.
Yeah, that power line. Fucking. All right. Let's give him a minute of intense stuff. Not trying to break him, but just trying to fix him, doing what it takes.
Oh, fuck. That is tough.
Yeah. It's okay if you're left a little bruise. Bruises change. Bruise is the body, you know, healing itself, processing what's just been undone. All right. Okay, I'm going to come off that. I'm just going to get you to move your arm. Look, tell me how that feels. I will move. Tell me how that goes, though.
Yeah, it feels pretty good, actually.
Yeah. Try the external. I know this has got nothing to do with external rotation, but just try some movements that you felt.
It's actually pretty good.
Yeah.
There you go.
There you go.
Yeah, that's good.
Yeah?
Yeah, no, I didn't expect that because I feel most of, like a lot of it up here.
Yep.
So I wasn't expecting that.
Fantastic.
There you go.
Fixed. All right, guys, Brachialis, make sure you haven't forgotten about it. We certainly haven't. Treat it, fix it, make sure you like and subscribe. Thanks for watching.